from my angina. I was just recently diagnosed with coronary artery disease, but I have no idea what's happening to my body. I'm a little scared, to be honest.
Well, I'm a first-year nursing student. We're just talking about coronary disease right now, so if you want, we can sit down and we can go over it a bit.
Yeah, I'd like that a lot.
All right, let's go find a seat.
The heart's oxygen and nutrient supply comes from two main arteries. The left main coronary artery, which divides into the left anterior descending and circumflex branches, and the right main coronary artery. Because the left and the right coronary arteries and their branches lie on the surface of the heart, they are sometimes referred to as the epicardial coronary arteries. They deliver blood flow to different regions of the heart muscle. The large amount of capillaries and the short diffusion distances ensures the heart always has adequate oxygen supply and removal of metabolic waste products. The blood from the capillaries enters the venules, which join together to form the cardiac veins. The cardiac veins drain into the coronary sinus, located on the posterior side of the heart, which drains into the right atrium. The coronary arteries are very important as they are the only source of oxygen and nutrition for the heart. The heart has a very high oxygen consumption. Whenever the heart needs to pump more blood to the body, for example when you go for a run, it is required to work harder, increasing its need for oxygen. Therefore, there is an increase in the coronary blood flow that is nearly proportionate to the increase in oxygen consumption. The coronary arteries are triggered by the sympathetic nervous system to vasodilate and increase blood flow to the heart muscle.
The pathophysiology. Coronary artery disease is when the coronary arteries become narrowed over time by fatty plaques. A person is considered to have developed the disease when the plaque damage is no longer reversible. The formation of plaque buildup is as follows. The lumen, or inner lining of the coronary arteries, becomes irritated, and an inflammatory response occurs. The reason for this irritation is unknown. Monocytes and platelets migrate to the area of irritation via blood. Monocytes use their membrane-bound adhesive proteins to stick to the lumen. They then wedge between the epithelial cells, where they differentiate into macrophage. Low-density lipoproteins are our bad fats, also called LDL, that reside in the connective tissue. The LDL move through the connective tissue to gather directly below the macrophage. The macrophage engulfs the lipoprotein, transforming them and the LDL into foam cells, releasing toxins and growth factor as waste. The growth factor breaks apart some of the underlying smooth muscle and helps to create a hardened extracellular matrix. The accumulation of these newly formed foam cells and its waste products create a buildup in the artery. This is what's considered the fatty plaque. The damaged muscle cells, along with platelets from the blood and proteins such as collagen from the exposed connective tissue, form a hardened layer over the fatty buildup. This hardened layer is called the fibrous cap. This fibrous cap makes it a stable plaque, and a stable plaque is irreversible.
Angina is the most common symptom of coronary artery disease. It is commonly described as chest pain and is caused when the heart muscle does not receive oxygen for a brief moment. This happens when the coronary arteries to the heart muscle are narrowed or blocked from plaque buildup. However, there are three types of angina: stable, unstable, and variant. Variant angina, or coronary spasm, is the most severe out of the three because it lasts longer, which puts you at a higher risk of having a heart attack. It also targets those who have coronary artery disease, smoke, or use stimulants such as cocaine. 2/3 of people who suffer from variant angina have already been diagnosed with coronary artery disease in at least one vessel. What happens is that the coronary artery has a spasm and pumps blood to the heart muscle at an insufficient rate, which lowers its oxygen levels and causes the patient to experience chest pain. Smoking is a major risk factor for coronary artery disease. The chemicals in tobacco harm the structure of your blood cells, which increases your chance of developing blood clots. Smoking increases your likelihood of developing plaque buildup in your coronary arteries, which in turn puts you at a higher risk of developing coronary artery disease.
So does that make sense to you?
Yeah, thanks Laryssa for explaining to me what coronary artery disease is. I now understand what happens when I experience my angina. Is that my heart muscle, the arteries through my heart muscle aren't giving my heart enough oxygen because they're now blocked from plaque, and that disrupts homeostasis of my body. And that's probably from my unhealthy eating habits, and I am obese, and I smoke too. So if I cut down on those, hopefully it will stop the progression of my disease and I'll get better.
Well, I'm glad to hear that.
Thank you very much.